Ever wonder when you have an infection and your doctor prescribes antibiotics and the drug does not work as well as you'd hoped? Antibiotic resistance is a growing problem, and ABC7 medical contributor Dr. Ogechika Alozie with Sunset West Health is here to explain. Doctor, what exactly is antibiotic resistance?
So it's really what it says, which is when you give a certain medication, specifically an antibiotic or an antiviral, it doesn't work because the bacteria or the fungus or the virus has found ways to beat the medication that you're giving it.
And how many, this is a national estimate from a while back, 2,800,000 infections, 35,000 deaths, and there's one that in particular there that's really resistant to antibiotics?
Yeah, absolutely. So Clostridium difficile is actually a type of diarrhea that people get.
Wow. And
it's caused by giving overuse of antibiotics. And so it is finding ways to beat what we typically gave it 5, 6, 7 years ago. So we've had to escalate to even newer antibiotics.
So what are the causes of antibiotic resistance?
You know, for me, the biggest cause is just taking too many antibiotics. Right, so we're in that respiratory virus season, whether it's RSV, whether it's influenza, whether it's COVID, right? A lot of times you go to an urgent care and emergency room, what do they give you? A Z-Pak, or cephalexin, or levofloxacin, or Cipro. And those medications do not work against viruses. A lot of people get urinary tract infections, and they're given round after round of antibiotics, and after a few rounds, it stops to work. That's the biggest thing. Another part of it is when patients just don't finish their medications, right? They take them a day or two, it doesn't reach the levels in the body that it needs to, then the bacteria or the virus finds a way to beat it. One other thing I'll say about that is the food that we eat, whether it's chicken or cow, whatever it is, we pump them with antibiotics. And so part of our food chain is already developing resistance before we ever eat it.
Now, I know you mentioned UTIs, and there is a new UTI drug that's in the process of getting FDA approval, which it may not happen until 2023. But creating a new antibiotic takes time.
Yeah, you can see from this slide really clearly, right? So the last time that we had a broad spectrum antibiotic, levofloxacin, was before I was born in 1962. The last time we had a more narrow spectrum, I was still in elementary school, right, about to be in high school. And so I think we are using up the resources that we have, and that's why it's so important, not just for the patients to understand this, but also for my colleagues who are also victims of overprescribing.
And there has been a decline in the number of antibiotics that the FDA has approved.
Yeah, it's hard to make antibiotics. I mean, first of all, people need to realize it takes 15 to 30 years to get an antibiotic through, from discovering it in the lab to getting it through clinical trials, phase 1, 2, and 3, and then actually marketing it. You can see those numbers going down. The orange bar you're seeing is specifically because the Food and Drug Administration has pumped money alongside the National Institutes of Health into creating more antibiotics, but we just don't have enough, and resistance is growing.
So what can our viewers do when their doctor does prescribe them an antibiotic?
I think the conversation with your clinician or physician is, do I need this antibiotic, right? If you have a cold, if you have the sniffles, that shouldn't be an indication to run to an urgent care or your clinic and say, hey, I need an antibiotic. We need to get out of that culture. I think never use leftover antibiotics. They actually do have a sell-by date, right? And so if you use expired antibiotics, that's not good. And at the end of the day, we're in respiratory virus season. Protecting yourself, whether by washing your hands, wear a mask if you need to, get the right vaccinations. Those are all the things that will protect you, and hopefully you won't even need any antibiotics on the back end.
ABC7 medical contributor Dr. Ogechika Alozie, thank you, sir.
Thank you.